Welcome to today's special event hosted by eLotus and sponsored by Evergreen Herbs. I'm Donna Chow, your host. As your leading source for quality CEU content with a legacy of over 2 decades, we offer educational courses to help you elevate your knowledge and expand your skill set. With over 250 speakers, 900 courses, and a staggering 3,500 hours of continuing education, we are committed to providing you with the best educational experience possible. Today's webinar is Acid Reflux and Diabetes, Dr. Jimmy Chang's Herbal Master Sheet. Dr. Chang's class will run from 2 to 4 p.m. Pacific Time. To ensure an interactive session, please set your chat preference to everyone, and do use the Q&A box for instructor questions. Dr. Chang is a renowned expert with over 40 years of clinical experience treating more than 500,000 patients. He will delve into pulse diagnosis and herbal prescriptions, focusing on his unique herbal combinations. He has been exclusively supplied by Evergreen Herbs for an impressive 25 years, making them the perfect partner for his clinical practice and research. We are honored to have Evergreen Herbs as our sponsor for this webinar, given their commitment to quality and service. Dr. Chang has previously taught courses for us, which are now available as distant learning CEU videos. Elevate your pulse diagnosis and herbal skills with the go-to expert. Consider the Gold Pass membership for unlimited access to his foundational pulse and herb courses prior to 2020. The Gold Pass with an exclusive herb voucher from our sponsor, Evergreen Herbs, lets you experience these herbs firsthand. A fantastic opportunity for serious herbalists. Let's begin today's class with a brief overview of Dr. Chang's unique herbal approach. If you're a seasoned student, please take a moment to review or grab a 5-minute break, as this part will be a refresher for you. Dr. Chang's herbal style diverges from traditional methods, exclusively utilizing extract powders from Evergreen Herbs, offering around 300 single herbs and 100 formulas. Dr. Chang's pharmacy boasts approximately 150 single herbs and formulas combined. Find more details in the YouTube video linked in your lecture notes. For those interested in starting a similar pharmacy, Evergreen Herbs is offering 15% webinar discount on the essentials. Find the link in the chat room or refer to your lecture notes for details. Formula evolution is at the core of Dr. Chang's practice. Creating his own formulations with names reflecting their purpose, Dr. Chang adapts them over time based on patient experience, marking updated versions with a 2.0. Part of the idea of formula evolution is Fang Jia Fang, or formula plus formula, in which Dr. Chang combines various single herbs or formulas to enhance their effects. Evergreen's extract formulas are decocted and extracted together, rather than just combining individual herbs. For a more detailed explanation of Fang Jia Fang, Dr. John Chen has a video explaining the concept in more detail. As for the dosage, Dr. Chang's herbal prescriptions are usually provided in 100-gram bottles with the recommended intake of 3 spoons 2 to 3 times a day. How do you interpret Dr. Chang's prescription? Well, the number following the herb signifies the percentage. For instance, in Sleep Combo 2.0, 酸枣仁汤 is 40%, and Yijiao Teng, He Huan Pi, and Zutongyan at 20%. So to test your knowledge, how many grams of Zutongyan would be used in a 100-gram bottle? Please type into the chat room now. All right, so the answer is 20 grams. Did you get that right? I'm sure you did. For those inclined to mix their own herbs, it's definitely an option. While some formulas like Circulation Sanjiao and Astringent Complex are pre-mixed in Evergreen's collection, many new ones are not, as Dr. Chang customizes them. But feel free to create your own blends or use Dr. Chang's formulas as a base. This concludes my short introduction, so let's go ahead and welcome Dr. Chang to start the class.
Hi guys, this is Jimmy Chan here. Oh, hold on. What? Don't use camera. I think it's on the front. Okay. You don't need this camera. You have a camera. Oh, with that camera. Hi guys, this is me again, Jimmy Chan. I'm here today to share with you some of my experience using very effective formulas and combination herbs for this acid reflux and diabetes. Wow, the diabetes is very popular problem, and so is the acid reflux. So I'm sure you can get some very valuable information today, and you can start using it tomorrow. You got good effects and good feedback. What? Okay. Oh. Okay, no problem. Okay. So this is the today, 13th of December 23. We're going to talk about acid reflux and diabetes, stuff like that. And also this cholecystitis is another reason for this acid reflux. So it's not just taking some anti-acid pills or something to stop the acid. We have to find out the real reason of it, why this patient is having this reflux and stuff, and how do we treat it, or at least change the condition effectively. And for the diabetes, that's a it's worldwide spread disease. So like a lot of people with that problem. So we've been talking about something very simple, and I mean a simple way of treating it, or to change the condition of the diabetes. That's very good. You'll be able to use it tomorrow morning right away. Okay, this is my information. Okay, and there's another bonus for your attendees. How can one enhance medical skills and learn greater trust from patient during consultation? When the patient sits in front of you, there are many reasons for why they're being there. There's somebody introduce you to it, see the ad or whatever, or they want to seek some alternative treatment from the Western ones, and they don't like taking the Western medicine for too long or something. And you have to present them that you have enough knowledge to help them with Chinese medicine. You can cure their problems, at least change their symptoms, or change all the things from the bottom up. And how you're supposed to do that? And I'll be talking about that drill at the end of the seminar. Mostly is that I don't ask. Do not ask your patient, what can I do for you today? Don't do that. I just sit there and start seeing all the symptoms I can gather from the patient's body. Like, for example, the palms. I don't look at the face. I don't even look at the tongue. The palm, the wrist, and the paws and ear point. We can get all the information we need, and which is very effective. And as long as you start doing this, I'm sure your business will go way up. Okay. Oh, so okay, you're lucky. You don't have to guess. Now look at that fat guy over there. Okay, there's a person sitting in front of you and saying that he has been having too much stomach acid. What should you do? Okay, go take some Tum-Tum, take some acid pills. No, that's not like that. We have to find a reason. So what should you do? You do my diagnosis, Dr. Chang's diagnosis system from the hand, palm, face, okay, face, whatever, and the paws and the ear points. As for this one, there's a point here. Ooh. See, this is the stomach area. This don't work. See? This is the stomach. And see the bump there? It's not red. It's the original skin color. So it means there's no inflammation and nothing but a bump. So all you have to do is destroy the bump and the stomach will be better. That could be in the door, the front door of the stomach. I don't know how to speak or whatever the name of it or whatever. But all we need to know is the nature of his problem. The stomach is pale and the block. We need 三棱而足 or something to destroy that. And this area is the neck and shoulder. So this little bump there, okay? And this is the hip. See the color is a little purple. The color there is a little purple. So maybe we should use some blood movers if see this one here? The patient is suffering from back pain. He must be. So we can treat it with no problem. But is this something funny? Okay. No, okay, that's it. And where is the Everything here is based on my 45 years of clinical try and error, not from the textbook. I don't trust the textbook. What would you do? We just talked about earlier about that the previous condition. If the ear point is very important for you because it plays like a role of a teacher sitting next to you, and you can see the nature of the problem. Like the previous one, there's no redness there. That means no inflammation. So you don't need to use too much cold medicine. All you have to do is destroy that mess. 这个是这样啊，你有问题吗？没有啊。Esophageal reflux, also known as acid reflux or gastro or whatever term, refer to a certain condition in which stomach acid and stomach contents flow back. So this is the mechanical part. Okay, flow back into the esophagus. There's some information. This is just general knowledge. It's no big deal. But look at this. See? See here the redness there? That's the inflammation. So you might use something for the anti-inflammatory agent like my APX or something like that. And for the lump is here. It's no big deal. The stomach. This is the stomach. Definitely some gastritis. And this is the colon. And also it means that's the hemorrhoid. See, this is very clear. Oh, this is the bump. See, it's a little bump here. And also this area is referring to skin problems. You see some redness there or some white bump, that's skin allergy. This is the hemorrhoid. You know the pause for the hemorrhoid? That's very funny. This is the 寸关尺. Usually the 寸, the right hand, right 寸 is high, and that means the yangming and the stomach and the colon. But actually the pause for the hemorrhoid is deep and scattered. I cannot explain why, but it sure is like that. Just try this the other way. No, it's not working. That has to go with that. 这个不能用吗？ Something like that. This is the hemorrhoid, and they have you can verify the condition from the ear point, huh? Okay, and this is the stomach. So in this condition, I have several very direct combination for this. And for the positive, maybe something like this. The right one, jumping and forceful. Actually, this pause also for diabetes. The stomach fire. I don't know why the stomach is connected to the sugar condition. I don't know why. It just does. For the direct medicine for clearing the stomach heat like this is 柴胡加龙骨牡蛎汤. 柴胡 is for liver and the gallbladder. 龙骨牡蛎 is some kind of anti-acid agent, but be careful. 柴胡牡蛎汤, 龙骨牡蛎汤 is more than just calming the acid. It's good for skin allergy, eczema, and for this formula is good for skin, eczema, and the mood. For those cuckoo people, crazy people, they don't know what to do every day. Seems to be the empty, like a no-brainer, walking around saying something. I saw a guy 37 years old, young and pretty strong. Not big one, not like Amigo people, just Chinese. It's pretty strong muscle or something. And I check his pulse. The right cun is so damn deep and weak. And I look at his fingertips, so small and so pale. I said, something wrong with your head. Your head is not clear or something. And also I see some dots on the head area. And finally I asked him, what do you want me to do? His wife said he has been out of his head for 2 years. Just no memory. Memory is very short. He's 37 years old, not 77. Lost his memory, didn't know what to react, cannot work, stay at home like a walking, like zombie, just like zombie. Cannot go to work, cannot drive, and looks so funny. He's not those affective odor, which is the young part, which means he will disturb or annoy other people. He's just being brainless, no head like that at home. His wife is so troubled by him. And he went to a lot of doctors, Western doctors, and they would give him only, antidepressant, tranquilizers, and make everything worse. So the pulse is on the right cun. Actually, I'm talking about hemorrhoid. This pulse is good to present hemorrhoid and head condition. And 柴胡龙骨牡蛎汤 is mostly for those affective odor. My dissertation for my master degree in USC is affective disorder. So that's the young type that will cause too much people annoying other people, like moving around, like the restlessness or something like that. 柴胡加龙骨牡蛎汤 is also for dampness, also good for the neck and shoulder, for the headaches, and for skin eczema. Hey, it's very good, huh? So, or I would say 半夏泻心汤. When you're trying to use the if the patient has been taking lots of those pills or capsules for acid reflux, if that didn't work, you can try this 半夏泻心汤. 半夏泻心汤 mostly for a lump in the stomach, something bloated here. And sometimes they feel like throwing up after eating. If the pulse is so greasy, I'm sure after all those years learning from me, you sure can find out the greasy pulse. Or you can take a look at here. If this area is with some green lines, you can tell he definitely have a lot of cholesterol. And I have two elderly man and wife. They came from Las Vegas, and they both taking the medicine for cholesterol and make the liver very bad. I didn't know that in the beginning, but I told them that your liver is very bad or something. But afterwards, they told me they were taking this what do you call it, whatever, for cholesterol. Those medicines are very damaging the liver and cause a lot of a digestion problem. But Western doctors, they always prescribe that because, yeah, your cholesterol is 120, 180. You must take the pills. I cannot say I tell them I cannot ask you to stop it, but it's up to you. It's very damaging. So this cholesterol, I mean, the 半夏泻心汤 can also help with the acid. But if the patient say, maybe you should ask when you take the pulse, okay. This is the 寸, this is 关 and 尺. Most of the time, if you push, I mean, if you put your fingers on the correct position, like my pulse diagnosis system, if this is 寸, but the 关 is 寸, sometimes you'll find a bump here. And also, it's possible happen, this is the right-hand side, this is the left-hand side. Also here, the left-hand side used to be liver, right? But in my second pulse synergy number 2, the left-hand side is also stomach. So here and here are meaning the same. There's something bump here. Maybe a little lump or little whatever, the stomach is pushing upward against the diaphragm by eating too much or something. So 半夏泻心汤 is the best formula for this pulse. I always use that, no matter what. But what I'm trying to remind you of is that if the patient says, oh, maybe just, do you feel throwing up? Okay. Do you feel throwing up after eating something greasy or not? So, no, whatever I eat, I feel like throwing up. The other chappy guy may tell you, oh, after eating something greasy, I feel like throwing up. Then you should put your mind, if something greasy causing this throwing up or belching or something, you should put your attention to the gallbladder, which is here. Sorry, this is the left-hand side. Sorry. Oh, I'm sorry. Yeah. On the left-hand side, left one, maybe you'll see the lump there. And like I said, after taking the pulse with my original pulse position, like a flat, put your fingers flat on the patient's the artery. Then second step, you should use your fingertips, single individual fingertip, to feel the pulse by doing this. Straight down, like this, vertically down. Then you might find little beans under the left guan, and that's the gallbladder, which you might see something here on this area. It can either be red or blue. So that's the gallbladder. So if the patient's main complaint is asking you to treat the stomach reflux, you should start treating it by focusing on the gallbladder. Okay? Any questions?
When you say that there's a lump, right?
Yep.
Do you mean an actual growth, a mass of a lump in the body, in the
Yes.
stomach area, or could it be like a chi stagnation or the diaphragm pushing?
You can
So,
try it.
soft lump.
After using 1 week or 2 weeks of medicine, if the lump didn't go away, then maybe something messy.
You're talking about the lump on the pulse doesn't go away,
Yeah.
right? Okay. I remember a long time ago you said that you can feel the lump, but then some of them, after you push it, it will go away. Some of them, after you push it, it's still there.
Yes.
So that indicates whether it's solid or it's more like a mild case.
I discovered several pulses like this. Okay. Very interesting. This is the original pulse. Okay. I find the pulse on the Shaoyin or the original pulse signs with something like this. Old lady with this pulse on the Shaoyin turned out to be a stomach cancer.
Shaoyin where?
No, here.
Oh.
It's on her
The
hormone area, but it also has 寸关子. It's on her left hand side. It's like just like this.
Then
it's empty. If I, you push it, and I remove the fingertip, it's still there. And when you press it, it becomes so no rebound, no support, not like a guitar string, just like this. I tell them it's like I have spotted so many this kind of pulses. When you touch it lightly, just like my feather pulse. If you have read my book, The Feather, floating and so weak, no support underneath. When you press down, it's gone. But you leave it, it just came back.
So that's on the south in heart channel.
Anywhere.
Anywhere on there.
Can be anywhere.
Okay.
I still don't know how to explain. I always tell them that, hey, your stomach is like some of the part of your stomach is like a balloon is about to burst. I don't feel anything. Okay, whatever. This one is like a feather. This is so, I still don't know how to end. So empty inside, no support at all. When you push it, it just collapses and no rebound, weak. And then still there. And sometimes they don't have anything. I don't know. This is not good. Just like somebody has a problem, is probably in the colon, and also just something like this. Then suddenly one day it bursts, or just aneurysm in the head. People, young people suddenly collapse and die because this invisible aneurysm inside the brain or somewhere. This can be anywhere. So somebody, the ovary bursts, and but the pulse is just like this. I don't know how to do that. But anyway, most of the time the pulse don't go away.